Now, the Health Minister, Dr. Christopher Tufton, says discussions are being held to determine the feasibility of testing visitors to the island when the country reopens to non-nationals on Monday. He was responding to comments from the Medical Association of Jamaica and the parliamentary opposition on mandatory testing for visitors. Shamela Pullen reports.
As the country reopens its borders to non-nationals on Monday, the Medical Association of Jamaica (MAJ) is strongly advocating for visitors to get tested before they enter the island. The government announced that those arriving from countries which had screening protocols would not be tested. Tourists will be restricted to a selected area along the north coast called the Resilient Corridor. But this has not appeased the MAJ, which argues that passengers should be tested in their countries before they leave for Jamaica.
The government has said that it's not feasible. We can't do it out here. Then have the persons do the test before they board their plane. All right, that is what we are proposing. Now, clearly, it's going to take some amount of consensus from all the stakeholders. That has to involve other governments, other jurisdictions, airlines, other players in the area. But it's something that I think can be achieved.
And the MAJ is getting full backing from the opposition spokesman on health, Dr. Maurice Guy. According to Dr. Guy, pre-testing of non-nationals would provide a greater sense of security to travelers as well as tourism workers.
There's a reason for pre-testing. One is that you decrease the burden of potentially infected persons coming into the country. The other reason why we support pre-testing is that it would give the workers a sense of security that we are protecting them from further infection, for not only for themselves, but for their families and the communities in which they live. And thirdly, it would give the visitors a sense of security that they are coming to a country where there is no coronavirus because you have pre-testing facilities.
But in response, Health Minister Dr. Christopher Tufton says discussions are actively taking place on the matter. However, he admits that COVID-19 has placed significant challenges for the public health system. He says the testing process alone for COVID-19 absorbs a lot of the ministry's resources, which is putting a strain on them.
At the Norman Airport where I went recently, we have to have 60 health personnel there, and these are persons you're pulling from different functions, the health centers and so on. So the COVID response to date has been a significant burden on the public health system and public health workers. And part of the assessment is really the practicality of implementing some of these procedures because it requires so much and other areas get neglected.
As such, Dr. Tufton maintains that the decision to test non-nationals entering the country is based primarily on a risk assessment. He explained that when this is done, recommendations are then made to the cabinet for a final decision.
The extent to which that decision is taken is a function of the risk assessment and of course ultimately a recommendation to the government, to the cabinet, who then takes a decision. And I'm saying to you that in some jurisdictions where COVID is not a big issue, we classify those as a bubble countries. So if a tourist were to come from those countries, then in the view of the experts, testing would not be necessary. In other jurisdictions, as defined by WHO or our own assessment, where risk is greater, then testing may become necessary. So it really is a function of where they are coming from.
Some countries are requiring tourists to test negative before they travel. Greece says every international traveler will have to enter through Athens and submit a health screening, which includes a rapid COVID-19 test. Shamela Pullen, TVJ News.